Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Hello, and welcome to the Cardinal Minute from University of Louisville Department of Medicine. We are here celebrating our final grand rounds of the 2023 year. And I'd like to introduce Dr. Ashley Cattran from University of Cincinnati. Dr. Cattran, can you let us know what our take-home points are today from grand rounds?
Absolutely. Thank you again for having me. I just wanted to highlight from the talk that sarcoid is a multi-system inflammatory disease of unknown cause, which causes formation of granulomas in pretty much any organ, but especially the lung. Diagnosed by having a compatible clinical presentation, non-necrotizing granulomas on biopsy, and excluding other causes. It's a rare disease, but likely under-recognized due to delays in diagnosis and undiagnosed cases. It's very important to note that African Americans have a significantly higher incidence of sarcoid, and they also have higher rates of multi-organ disease, severe lung disease, and higher mortality rates. Mortality rates are higher in women as well. There are diagnostic guidelines available from an ATS 2020 statement that highlights using EBUS as our preferred diagnostic test for mediastinal lymph node sampling, and it highlights important baseline screening tests for all new diagnoses with eye exam, CBC, CMP, and EKG. Treatment guidelines are available from the ERS in 2021 that summarizes treatment decisions that should be made based on risk for organ impairment and impairment in quality of life. And unfortunately, all treatments for sarcoid have significant side effects and toxicity, but first line for sarcoid remains steroids. Second line in general is methotrexate. Third line can include TNF inhibitors. I also wanted to note that hypercalcemia is common in sarcoid, and it's recommended to check both 25-hydroxyvitamin D and 125-dihydroxyvitamin D prior to supplementing, given the risk for hypercalcemia in these patients. And we still do not have good biomarkers for monitoring disease activity, including ACE levels, which have mixed data and overall not sufficient evidence for use in clinical decision-making. Lastly, we have future research and therapies on the horizon for sarcoid, and there's a big need for more effective therapies with less toxicity, so we're hopeful that that will bring us new options. Thank you.
Thank you so much, Dr. Cattran, and we'll see everybody next time and next year on the Cardinal Minute.